Good afternoon, everyone. I wanted to take a few minutes to visit with our students, our faculty, our staff, alumni, and friends of the college. I can say with confidence at this time, there are no guarantees about what will happen tomorrow, next week, or in the next few months. There will be short and long-term effects from this crisis that we may or not be able to anticipate. There will continue to be a great deal of uncertainty for this nation and the world in the days ahead. However, I draw hope and confidence during these turbulent times because we have a dedicated and knowledgeable group of faculty and staff who will get us through these difficult times. I'd like to give you one example of that hope. My father-in-law, who was a scientist at NASA, tells the story of Apollo 13. You can also view it as a movie made by Ron Howard starring Tom Hanks. In it, Apollo 13 was supposed to be the third mission to the moon. And going there, something terrible happened. There was an explosion, and it appeared that the astronauts were not going to be able to get back. But incredibly, the scientists and the engineers knew what was inside the capsule. They put it all on a table, and through innovation, were able to figure out how to get those astronauts home. And so the same thing is going to happen here. Medical scientists in this country and around the world will test new vaccines, new methodologies, and then we'll be able to come back to this college because we know this is temporary. Of course, we're now moving to remote learning, and I want our students to know that there will be some trial and error in this process. But our faculty will be working hard to correct these shortcomings in our delivery system. So some of them will do their work with you online. In other cases, it will be, they may share their notes on Blackboard and pick up the phone and chat with you. They might use Zoom or even Skype. So please be patient. We're all learning together. I do want you to know that I have heard from students and faculty how heartbreaking it is for them not to be able to return to the campus. For faculty and staff that I have visited with, they comment on missing their students and their colleagues. Our students speak to missing their friends and spending time with faculty and staff in their offices who've been important to their education. Our community is unique in that it truly cherishes that personal contact we have with each other. Ellen and I were just saying last night how difficult it is to live in a ghost town. And for our seniors and student athletes, actors, musicians, student club officers, and everyone else who is looking forward to the semester, I am too mad at what happened. We all realize that so many wonderful opportunities are being stolen from us. Nevertheless, there is nowhere to place blame. This unprecedented virus has caused so much unimaginable illness and death, but we'll get through it. So I would ask you to please reach out to each other through social media, email, or just pick up the telephone and speak to someone. We are worried for you about the loneliness you might experience, the anxiety, and the possible depression caused by this disease worldwide. Our counselors are prepared to visit with you. So let me share with you a message sent to me by the counseling office. The Counseling Center remains a resource for all our students, and they'll be able to visit with you about mental health concerns in the days and weeks ahead, about supportive interactions and help with referrals in your local areas. Of course, all contacts will have to be remote to ensure social distancing. Counseling staff as a department will be sharing more online resources for students, so please go to their website or look for an email in how to promote and maintain your well-being. These may include encouraging you to take a break from engaging with news stories, including social media, to take care of your body and your physical health, and find time to unwind and relax, and to connect to others remotely and share how you are feeling. Please check the Counseling Center's website again regularly for updates on promoting your health. The Counseling Center can also help you brainstorm ideas about how to manage your stress and anxiety. Since the staff, as I said earlier, will be available only remotely, there may be a lag time between when you call and when they're able to respond. If you find yourself having a health emergency, please call 911 or contact the closest emergency room for assistance. So I'd like to share another story. My wife and I went to get some food at a fast food place, and as we drove up, the young lady in the window said, "Well, hi, Dr. Bitterbaum, how are you?" And I asked her, how was she doing? And she said, "I'm really sad that I will not be able to see my friends the rest of the semester," but that she had developed a chat room in which they were conversing with each other and trying to stay in touch with each other. I thought that was terrific. So I'd like to end this video with an interesting observation from a writer from the Chronicle of Higher Education. I love her name. It's Goldie Blumenstick. And this is what she said: "We need to rethink the term social distancing. What we need to do is practice physical distancing, but social solidarity, by making every effort to support folks in our various personal communities. As we stay apart, wash our hands, and try to stay safe, it's good to remember that we're all in this together. I miss you. I look forward to seeing you back on the campus, and be safe." Thank you.